With a population of more than 200 million, Nigeria is Africa's most populous country. However, our health system is fraught with many challenges, including poor health infrastructure, a shortage of manpower, and weak systems. These have contributed to poor utilization of our health facilities, particularly the primary health centers. This is worrisome because while primary health centers constitute 85% of all clinics and hospitals in the country, only about 20% of these are functional and can provide basic emergency obstetric services. While it is a known fact that the Nigerian healthcare service and system have suffered several infectious diseases outbreak year after year, there is need to tackle the problem. To give up-to-date recommendations for the Nigeria healthcare system, we are now joined by Dr. Tychus, CEO, founder, Get Medco, to provide some perspective on improving access to health care services here in Nigeria. I want to say thank you very much for joining us.
Thank you so much for having me.
Yes, and like our introduction actually just stated, the primary health care service and centers are like the first point of call, first of all, the bedrock of our healthcare system here in Nigeria. What can be done? Because we usually, when we talk about healthcare, we look at hospitals, right, and without focus on these primary healthcare centers that provide the day-to-day services for majority of the populace here in Nigeria. How can we improve that? And how can we focus directly on that to improve that and probably start it off from there?
Sure. So we can look at it from the genesis of the problem, or we can look at it from the problem and work our way backwards. So number one is there is a shortage of doctors. There's a shortage of primary care everywhere in the world, actually. So when we look at even the US, the UK, you have a dearth of physicians, which is why they look to the African market, especially Nigerians, because 70% of Black doctors are actually Nigerian. So the number one reason that doctors are leaving Nigeria is the lack of good healthcare facilities. Lack of security is number two, and then also the salaries are not comparable to those countries. So I think if you want to start from the problem, I would say, let's focus on those three. I did coin a phrase for the healthcare sector and how we can fix it. It's TRACE. T is for training, R is for retention, A is for access to healthcare, C is for consequences, and then E is for equity, meaning that there should be equitable healthcare across. And I think, addressing these different buckets would be very, very helpful. But we need to increase the number of doctors because the population is burgeoning, is increasing, and I think that's where we need to focus. So how can we stop this, how would we call it now, migration of doctors, and keep the doctors here? And I think number one is I see a lot of hospitals. I've visited a lot of hospitals while I've been here. They're making a lot of positive changes within their facilities because that's an important aspect to attract talent as well as to retain talent. And then the second thing is how can we increase salaries? Not just in the hospitals, but also in the general hospitals, in the primary care settings and things like that, because that's also what is going to keep doctors here instead of them moving to greener pastures, as it were.
Okay, so there's been a subtle emergence of specialist hospitals in Lagos. I'm sure you must have observed that. So how impactful is that to specific ailments like cancer treatment, on the long term? And you can't help but think that this is probably restrictive to a particular class of society.
Absolutely.
So how do we go beyond that and make it more available and affordable as well?
Exactly. What you said is so important, and that was the E part of the acronym, the equity. Because yes, there are more specialists, but how many people can actually afford cancer treatments? Cancer treatment is not just expensive, it has a lot of consequences. People can fall sick, they require a lot of hospitalizations, transfusions, things like that, which a lot of people might not be able to afford because of their socioeconomic status. So this is where I believe public-private partnerships come into play. So the government should typically step in to help mitigate some of these costs that a lot of people might not be able to afford. So another good example would be even dialysis. Research has shown, and the latest research I found was from 2000, 12% of Nigerians actually have end-stage kidney disease. They're on dialysis. but dialysis costs about 30 to 60,000 per session, and you're supposed to have 2 to 3 sessions a week. So in a month, you're spending 300,000 naira. I mean, how many people can really afford that? And this is a lifelong treatment, except you get a transplant. So this is where the government needs to partner with the private institutions, so that way the average Nigerian can actually afford these very important life-saving treatments.
All right, so I would like to find out, let's take this discussion back to the doctors.
Yes.
Because you mentioned, first of all, it is almost very clear that doctors in Nigeria cannot earn comparative and also competitive wages like doctors probably in the UK, in the US, Canada, and the rest of them. That is a given. How do we still help, how do doctors that probably have gotten their MBBS and taken that particular oath look at the humanity side of it and not necessarily the monetary side of it? Because a lot of people have questioned and also attacked the NMA and the Residents Doctors Association that it's most of the time it's not just about remuneration. Sometimes you need to fulfill that obligation and that oath to service to humanity, which a lot of people do not always want to, because they would always say, if you want to serve humanity, but you must also be alive. But how do we balance both sides of the divide, that we have enough people that can actually, that can reduce the doctor to patient ratio here in Nigeria?
Yes, so medicine is a humanitarian or is a service to humanity, I should say. You know, even me practicing medicine, you know, the money is secondary, I would say. Really, it's more, I get joy from the way I serve people, from making them better. So there is a very fine line, and people will do it for so long. And I think that's the issue, that how long is so long? Is this going to be for the rest of my life? Is this going to be for 5 years? Is it going to be for 10 years? You know, people don't mind as long as you give them a time frame and then things get better from there, because they too have to make ends meet. A lot of times people hear doctor, you already know the family is already looking at you, oh, you're a doctor, you should be. So there are a lot of demands, you know, that, and then they look at their counterparts who are in the States, who are in the UK, and it becomes more difficult. So yes, there is a humanitarian, and I really want to,
it cuts across.
It does.
All divides of life, basically, because I'm a journalist here in Nigeria.
Yes.
I know how much my counterparts do earn, probably in the US and the UK.
Yes.
And you don't see me holding the placard and insisting that we get equitable wages.
Right, but at the same time, the US and the UK might not be trying to lure you over there. You see what I'm saying? Maybe they have enough journalists, but they don't have enough doctors, and that's for sure. So now they're in a tight spot, and they're like, where can we get doctors from? Guess what? They're going to come here. So now they're advertising these things. They're advertising visas. They're advertising access. Canada is doing it. The UK is doing it very strongly. So now there's this pull. So where there wasn't that pull before, now it's really, you know, strong, where people have to say, do I stay here? Or do I go there? I'm still doing good either way. It's just on which side of the pond, if you will. So I think it's a very difficult place, and if we keep relying on the altruistic aspect of our doctors, we're going to be very disappointed. I think as a country, we have to say, okay, how can we help? How can we step up? How can we compete? We might not be able to compete at that level, but I think when people see effort, they appreciate it.
I would like us to delve a little about innovation within this sector. Can you give us more insight on telemedicine and what are the prospects for the Nigerian healthcare? How transformative is it? And I can't help but think it's still more at its infancy here.
Yeah, but you know, COVID did a lot to actually move it much further than it has been. Telemedicine is very powerful. Approximately about 80% of medical issues, conditions can be diagnosed virtually. So just by a video visit. So you don't even need to go in to see the doctor. And guess what? You can do telemedicine from anywhere in the world. So I can be in the US and I can examine and diagnose you with about 90% accuracy as if I saw you in person. So I think there's a very strong case for this, and that this might be a bridge for the primary care, if you will, but there are a lot of things that still require that you know, human touch and human interaction, if you will, physical exam. But in the meantime, I do think that we can leverage telemedicine The only thing with that is you have to have internet. You have to have electricity. Thank God for phones and things like that, so people can use that. But a lot of people now are providing that service, and I think that we should definitely capitalize on it. In fact, with the rise of like AI, it's even much easier now to be able to get care that way.
All right. It's unfortunate we're out of time.
Yes.
I wanted to find, of course, you are the CEO and founder of Get Medco.
Yes.
And want to talk about the fact that are we now beginning to see a change in luxury healthcare, not just going out and people actually staying back and actually getting, can people really get premium healthcare service in Nigeria without having to travel abroad?
Absolutely, absolutely. And that's one of the things that my company is focusing on. We're saying people are traveling abroad because of, they question the how good, I should say, the medicine is here, right? And they're traveling abroad to get this kind of care elsewhere. So one of my assignments, I believe, for myself is how can I bring this kind of medicine back home? How can people who grew up here, you know, say who want to give back, come back and give this kind of service to people here? So it could be through luxury, and it could be, for example, I plan to give hours in different hospitals and things like that. So I think that there's a huge opportunity for medicine like this, for people to come back, for people to have that level of flexibility so that they can give back as well.
And the giving back, we're seeing probably just a subtle signs of that, and that's why I asked you about the specialist hospitals we're seeing springing up every now and then. Dr. Tychus, CEO, founder, Get Medco, I'd like to thank you for your thoughts on this issue. It's good to have you with us.
Thank you for having me.